it was quiet. For the first time in probably 25 years, it was quiet. All of a sudden, a comfort level comes over you and you feel relieved. That's the best way I can describe it. So when I'm working on my recordings or working on music and stuff like that, I can hear better than I could 30 years ago.
Today I'm joined by Kent, who successfully treated his tinnitus, and today he's here to share what worked for him. Kent, what's your message to those listening who may have tinnitus ringing in the ears?
I just like to share that there is hope out there, and there is a treatment plan that works, and definitely worth the time to investigate.
All right, well, today I'm really curious to learn more about your story. My name is Dr. Ben Thompson, for those listening, with Treble Health. So, Kent, walk us through where you are today with your tinnitus in terms of the volume, the intensity of it. Where are you at right now? And then where was it at when this was at its worst?
Yeah. So my tinnitus level is the lowest it's been in probably 25 years, and I feel like my hearing is better than it's been in probably 30 years. The reason that I was seeking help was mainly because of hyperacusis. I was getting a real problem with sound sensitivity, and so that's what brought me to looking for help.
Excellent. And you worked with our team at Treble Health, so we're here to share some of those tools that worked for you, and other people can learn from them and also get inspired. Ken, I spoke to a patient today. She was living in New York City, and she explained that she had sound sensitivity. She just couldn't really be around noise, like traffic noise. She hadn't gone out to a restaurant with her friends in a year. She went to doctors and were told, hey, there's not much you can do for this. What was your experience with sound sensitivity, with tinnitus, with hearing? Tell us about what was wrong and what eventually you did to get better.
Okay. Yeah. So when I went for help for sound sensitivity, that's what I was initially going for. Obviously, I already knew that I had tinnitus and had had it for many, many years just from playing music. But they basically gave me a hearing test and said that I had hyperacusis and that I obviously had tinnitus and said that there's really no cure for it. The doctor that I had said that he had heard that there were some vitamins that you could take and stuff like that. And so I kind of left there with kind of a hopeless feeling, thinking that, oh my gosh, am I going to ever be able to play music again? Number one. Number two, am I going to be able to ever be in a crowded room again? So I know exactly what she's talking about, that feeling of that. And so that's what led me to seeking a cure.
And what did your hearing test find?
Hearing test said that I had a notch out at a certain like 3 to 4K, which is common for musicians, especially drummers. And so I kind of knew that already. He was able to see that the left and the right were definitely different and that I didn't really show signs of hearing that much hearing loss, that it was not a problem with my eardrums. It was not a problem that we could take, Medicaid or anything like that. It was just something I was going to have to learn to live with.
Very important to get that ENT evaluation at the clinic because they can determine, hey, is there a medication or surgery that would apply to your case? And in your case, it sounds like no, there wasn't. And that's 99% of cases of tinnitus. What's your background with music? How many years have you been playing?
I started playing in bands in 1980, so many, many years. And most of those years were not using hearing protection and stuff like that. As time went on, I noticed the ringing. And, at first it doesn't really bother you. It kind of gets better with time away from it. And then eventually it gets to the point where you just have it all the time. But, I learned to live with that. I was so used to it for all those years. I would say I've probably had tinnitus probably for between 25 and 30 years steady. So I had learned to live with that.
And the hearing test showed some hearing loss. Did you perceive difficulty hearing? Did you notice difficulty understanding speech clarity in different situations?
No, not regularly. I did during that time when when it had flared up and hyperacusis was kind of showing itself. I was having trouble figuring out like where sounds were coming from. She described certain sounds were definitely magnified. Like if an AC came on in an industrial building, I could hear it for no reason. I knew it was on and it was bothering me. So
Understood. So these symptoms you had primarily sound sensitivity. So everyday sounds were too loud. What specific sounds were triggering this for you?
well, especially like just everyday sounds, like even closing a closet door or the clanging of dishes, like she said it in a restaurant, that's when you really knew it. And I have a recording set up, so I record music as well. And so I felt like I wasn't able to get a good center I couldn't tell where things were coming from. I initially thought that I had an eardrum that was maybe had ruptured or something. I really didn't know. I had never experienced anything like that before.
Okay, so at this point in your journey, what would you tell to your younger self, someone who had these symptoms, clearly needed some help, was told by a doctor there wasn't much they could do? What advice do you have now?
Definitely, do your research and, just look, at what's available. I would also say, hearing protection is pretty important. I mean, I definitely, did do that, but I think some of the damage was already done. There is treatment, and I never had heard of it before, but, it made sense to me.
Okay, and how did you find us? How did you get connected with your audiologist from Treble Health?
After I got that diagnosis, I was searching the word hyperacusis and what the definition was, and in searching that online, I came across some YouTube videos of that you had done and that a few of the other doctors, and I kept on seeing this common denominator of Treble Health. And so I said, "Well, I'm gonna watch those and just see, these are people they were describing a lot of the same things I was having happened to me." And so I was interested in seeing what they had to say about it. Is it just something you have to live with, or is it something that can get better? And so as I watched, I noticed that when it was at the worst, if I put in either earplugs or if I put on my earbuds and had music at a low level, I noticed that I'd get some temporary relief. So the things that they were saying made sense to me. Maybe this could do it, you know?
That's great to hear. I'm glad that we could have helped, but you took the next step of actually signing up for a proper treatment. Is that correct? So tell us about that and what did you actually do? What tools did you use that helped you get better?
So when I went through my first consultation and they kind of told me what the program, what to expect, maybe some of the pros and cons with it. And I ordered my devices. I decided to go ahead and go through with it. They fitted me for the devices. Then we had another consultation where they picked some different options for sound therapy sounds. So from then on, it was pretty much me just, okay, now I've got to commit myself to using the devices and being stringent with doing that and really paying attention to what's happening. At first, we were meeting every week, and then as I was getting more comfortable with the use of the devices, then it was like every couple weeks. Then it became every couple months.
So what devices were you using and how would you describe what they sound like to someone who hasn't listened to them?
I guess they're actually hearing aids, and they fit over your ear. They're very non-intrusive. No one can even really tell that I have them on. What they're doing is putting in low levels of either, for me, it's pink and white noise. I like that. There's many options you can choose for the different sounds that you want. That they teach you how to put it, or I mean, just below the sound level of the tinnitus. I'm telling you, within 2 weeks, I could already sense I was having very few flare ups. And then within a month, the flare ups were gone. The hyperacusis, the tinnitus was still there. They had already kind of explained that to me that this is going to take time. But the level, I noticed when I'd take those hearing aids out at night, it was quiet. For the first time in probably 25 years, it was quiet.
So what you're showing is a successful sound therapy treatment, right? And it is quite often to have tinnitus and hyperacusis sound sensitivity at the same time. That was certainly applicable in your case. Wow. So you're showing a story here that by the end of this, you were in a much better state. So how much better did things get? Do you experience any hyperacusis and what level of tinnitus do you experience now?
Yeah, yeah, no hyperacusis and tinnitus.
Congratulations.
Yeah, thank you. Tinnitus level is down lower than it's been in 25 years. And so while it is still there, my hearing is better than it's been in 30 years. So when I'm working on my recordings or working on music and stuff like that, I can hear better than I could 30 years ago.
Did you use the devices for hearing loss? Because these devices can also be programmed for hearing loss. And sometimes with patients, once the hyperacusis and tinnitus treatment is finished, we would still use the devices just as hearing aids. So did that apply to your case?
It did not apply to my case. They reviewed my doctors reviewed the hearing test and decided that I did not have enough hearing loss to merit that. And if it worked out good, that I could just go with just the sounds, which has worked fantastic. And for me, it's been real simple. It's just been pink and white noise. For whatever reason, that works really well with me. I don't know how to describe this better, but when you have this going on with you and you put these devices in, it's a relief. All of a sudden, a comfort level comes over you and you feel relieved. That's the best way I can describe it. It's something that when I was worried about all this, when it was really flaring up, I really thought that I was just going to have to live with it for the rest of my life. I thought I was going to have to just figure out, do I just have to wear earplugs all the time or what am I going to do? But this is an absolute relief.
I'm so glad to hear that you have put in some work. What advice do you have for those listening who have tinnitus or sound sensitivity right now, and maybe they've had this for a few months? They're struggling. They're watching this video because they need to get some inspiration. They need to get a plan. They might be considering a treatment. What do you say to them?
I'd say definitely reach out, consult with a tinnitus specialist and really consider getting this because it's going to affect your life. It's going to be the one of the biggest reliefs you probably ever had.
So, what's your future here with being a musician, with having tinnitus? What's your future with how you protect your hearing or how you play music?
I've definitely, in my older years, I've gotten a little better at lower volumes. So I try not to do as much high volume as I did when I was a younger person. So, and I do wear hearing protection when merited. I've learned tinnitus doctors had some really good advice. When should you and when do you not need to worry about it? When do you need to worry about hearing protections? That was very valuable in itself. So, my doctor had been through it herself. She's speaking not only from having clinical knowledge, she's speaking from experience herself. She knew what worked, and I really appreciated the advice.
And you worked with Dr. Suzanne May at Treble Health,
Suzanne
correct?
May. Yes. Mhm.
Excellent, excellent. Yeah, having a doctor who personally went through significant tinnitus and treated
Yes.
it herself, that's amazing.
And plus, she was a musician too. She knew where I was coming from as a musician with this could be potentially career ending or definitely lifestyle changing. I definitely appreciated her insight. And I'd say another thing that goes along with this that maybe people don't think of when this is flaring up, your nerves are on their edge and you are tensed up and you are really worried about this. And so one of the things too that this sound therapy does, it helps relax you to kind of take that away and help you realize that my ears are working fine. It's just really important to seek the help.
For those who want to speak with a doctor specializing in tinnitus, you can reach out to our team at Treble Health. I will put the link right there on the screen. So definitely reach out if you are in need and want to ask more questions to see which solution is right for you. Kent, it's a pleasure.
Yep.
Your story will help thousands of people, and I really appreciate you being here.
And I just thank you guys so much for what you've done for me. And I would definitely recommend Treble Health.
I appreciate that so much. All right, guys, make sure to watch more videos here or reach out to Treble Health if you need help for your tinnitus, sound sensitivity, or hearing. Thanks so much, and see you soon.